For nearly 30 years, Grand Rapids Fertility and IVF has been helping couples with fertility problems across West Michigan.
So today we've asked Dr. Doug Daly to come in and talk about the practice. Welcome. This is a really interesting topic. Really, what are some of the things that couples come in and ask you, are interested in learning for Grand Rapids Fertility and IVF?
Some couples come in, they have a fairly good idea of what their problem is already. So if a woman is not cycling, is not having periods, she may not wait the classic 1 year of unprotected sex before coming in, and that would be appropriate, because if you're not cycling, you're not going to conceive. So that's one of the issues that we potentially deal with. On the other side of the coin, we have couples that have regular cycles. They've been having unprotected sex. They may go 3, 4, 5 years before they seek help, which is really longer than they should. So our goal is to try to get couples in at a reasonable time frame. If they have a concern, then come in early and discuss it. If they don't have a concern, don't wait forever. Come in a year, year and a half of unprotected sex. Most couples will conceive regardless of their age. Though as you get older, it does take longer.
And you were telling us that part of this is really an evaluation, because there really are 6 different problem areas that can cause fertility issues with couples. It's not just one thing.
That's correct. There's basically 6 questions we're trying to answer in the evaluation. 2 on the male side, are there sperm and will the sperm do their job? And 4 on the female side, are there eggs? Will the eggs do their job, which is really the one thing we can't answer. Are there anatomic issues in the woman that might interfere with pregnancy, such as fibroids, polyps, other structural issues? And then finally, is there any evidence for previous infection and tubal disease, which might prevent the tubes from functioning? Basically, we try to evaluate those 6 things over the first month or 2 of evaluation. Sometimes it comes out in the history, sometimes it comes out in testing. And then we try to design a treatment protocol that gets around those areas that are problematic. If the male has perfectly normal sperm, then we don't really need to address that issue. On the other side of the coin, if the sperm are rare and our assessment is they're probably not going to fertilize the egg, that couple probably is going to be best served by going directly to IVF and a procedure called ICSI, which involves injecting individual sperm into individual eggs to generate an embryo. So we try to pick out the treatment that is going to get the couple to the end point they're after, a baby, in a reasonable period of time at a reasonable cost. And unfortunately for many couples, cost is an issue, because this is an area that is poorly covered by insurance.
Right, yeah, definitely. Well, you've been in the biz for a long time, decades in fact, so you have a lot of experience, and you've talked with a lot of couples and a lot of families. Are there people that come to you that are convinced that they've exhausted all options before thinking about IVF or some of the other treatments that you offer?
We have couples that come in who have done nothing in the past. We have couples that have come in that have done procedures elsewhere and been unsuccessful. It ranges over the full gamut. What we do suggest, we try to be terribly honest with folks, so to speak, and tell them what their prognosis is. And the reality is, for some couples, you have to tell them, with your eggs and your sperm and what the underlying issues are, pregnancy is probably not going to happen. You need to consider other options, such as adoption, egg donor. We run a quiet embryo adoption program inside the practice. We don't market that to outside couples. That's something reserved for the patients, our long-term patients, so that each couple will have their own niche, so to speak, of what their potential is, and based on their potential, that determines what options they have. Unfortunately, for some couples, the options that are available to them that are likely to succeed are not the options that they want. And we can spend a lot of time talking about the Rolling Stones song, you can't always get what you want.
Right.
Because the reality is, for some couples, that turns out to be the case.
So how would someone get the process started? How would they contact your office? Do they don't need a referral from another physician?
No, you don't need a referral. You can contact our office directly. The office number is 774-2030. They can also go to our website, which is grandrapidsfertility.com, and there is an Ask the Doctor question there. So we specify in that Ask the Doctor that it has to be a general question. You can't ask a question along the lines of, I have such and such and such and such, what do I need to do?
Right.
because I can't answer specific questions over the internet. I can give general answers, but I can't give specific answers.
So to really talk to you, because I know each case is individual, and each couple and each person, and so to talk to you further about it and to really find maybe some underlying problems would be the first step.
It would be the first step, which would require an appointment. One of the things that makes our practice a little different than other practices is that I don't use physician extenders. I do my own ultrasounds. The patient sees me on every visit. They get to talk to me at every visit. They should have a very good idea of where they're headed and why they're going in that direction because of that. And we try to take the uncertainty out of, well, what is my treatment really? Our patients should know what the treatment is. If they have any questions, they have the opportunity to ask me at every visit.
And that's your 3 decades of experience. They're talking. You're not going to get that anyplace else.
Yeah, and as I said, at times I can be, for lack of a better term for it, brutally honest with couples and tell them, the direction you're going is not likely to produce the outcome that you want. There may be better uses of your limited finances. The reality is 90% plus of our patients have limited finances, and the question becomes not only what can we do to get them to conceive, but what can we do that they can afford that will allow them to conceive.
Right. Well, Dr. Daly, thank you so much for coming on and sharing the information and experience that you have. We're going to put all the information on our website so it's easy for folks to get in touch with. Thanks a lot.
Thank you very much.
We'll be right back.